Hello, everyone, and thank you for joining today's Task Force Town Hall. We're ready to go ahead and get started. And I'm Derek Miller. I'm the president and CEO of the Salt Lake Chamber. I'm also the chair of the Utah Economic Response Task Force. For those of you who have joined with us frequently, you know that we typically have these Task Force Town Halls on Tuesdays and Thursdays at 4 p.m. Today is obviously Friday, and it's 1:30, and so we're starting a special task force town hall this afternoon for a special purpose, and we appreciate you again joining us. The purpose of today's task force town hall is to discuss in some detail the release of version 2.0 of the Utah Leads Together plan. Before I turn it over to Natalie Gochnour, who led the effort on drafting this plan, and I'll have her talk about the team that advised her, I just want to mention that when the Economic Response Task Force was established weeks ago, it was from the beginning an eye towards getting us back to work and reactivating our economy. The task force began that planning in earnest on day one. The governor earlier this afternoon held a press conference where he released version 2.0 of the plan. And he talked about how it contains a framework for reactivating our economy. The Economic Task Force assembled a number of subject matter experts into working groups from nearly 80 industry associations, as well as local chambers of commerce, the healthcare community, the education community, and businesses of varied sizes from across the state. To tell us more about his press conference and his announcement, we want to turn it over to Governor Herbert. Governor, are you with us? I got a note saying he was, but apparently he's not yet. So let me just continue on for just a moment to let you know that these are some of the most capable people that I've been honored to serve with, who helped put this plan together. I want to thank each of them publicly for working around the clock in this fight against the pandemic. Contained in this plan is a high-level summary of business guidelines and best practices for operations that are spelled out according to certain risk levels. It's important to note that this has been a grassroots effort with real-world guidance from industry across the state. There is also an addendum that you'll hear about in today's town hall that has even more details than are found in the plan. And both of them, both the plan and the addendum, can be found at coronavirus.utah.gov. This way that we have worked together hand in hand between the public sector, government, and the private sector business is an example of what we call the Utah way, and it is a way that benefits the entire state and its people. Speaking of the private sector, I just want to conclude my opening remarks by saying that I've witnessed firsthand how innovation and dedication of employers and employees has worked during a very challenging time. It reinforces my belief that these same employers and employees will be diligent in staying safe and protecting their customers and also remain open for business. Lastly, it's one thing for a business to be open, but it is something else entirely for a customer to feel comfortable to walk through that business door. That is why the measured approach that is contemplated in version 2.0 of the Utah Leads Together plan is not just a plan for business. In fact, it's not just a plan for how businesses can begin to dial up and reactivate their business, but also it is a plan for building consumer confidence and encouraging Utahns to stay engaged in the economy. I believe that Utah Leads Together 2.0 provides a roadmap for Utahns to see the light at the end of the tunnel, to inspire hope, and to demonstrate a vision for the public safety and economic renewal that we all seek. With that, Natalie, I want to give you the time to walk us through the plan. Can you hear me?
I can, Derek, and let me just start the video there. Give me a thumbs up that you're seeing me and hearing me.
I can hear you and see you.
Great. Well, nice to see everybody. It's hard to share a plan this complex and do it succinctly. And I'm going to do my best. Derek, are you okay if I take 5 or 10 minutes to do this? Will that be okay?
Let's do the 10-minute version, Natalie, because that's why people have joined on this special town hall. So let's give them what they came for.
That's great. I'm going to go ahead then and put this up on the screen. I'm sure the chamber can distribute this to everybody. You should be able to also access it at coronavirus.utah.org. But I will just say that version 1 of this plan had this same language on the front that basically referenced that this was a dynamic plan for a dynamic situation. I think there's a likelihood that we might do 5 versions of this plan. This is a new era for us. I heard Governor Leavitt say today that 9/11 was an event and COVID-19 is a new era. And so we're in this business of managing this risk, and the Utah Leads Together plan thinks through that. I will also highlight that in the governor's message, he's very clear to thank our heroic healthcare workers who are standing on the front lines of this battle, and also to thank Utah businesses and industry for their grit and determination to get through this difficult time. If you remember, version 1 of Utah Leads Together really introduced these 3 economic phases: an urgent phase, a stabilization phase, and a recovery phase. And in version 2, we reaffirm those phases. And we also reaffirm these 3 major actions to continue to follow public health guidelines, stay engaged with the economy, and assist those in need. We then go on to provide an update of the phases of this reactivation and the urgent phase. And we share some of the data in hospital capacity, transmission rates, COVID-19 cases that are looking promising enough that we think we can start to entertain what would it look like to reactivate this economy. And so that's a big part of what this version 2 does. I will highlight, if you look at this map on the left, this is unemployment insurance claims as a % of the employed population. And we can see that both the serious impacts, but you can also see that areas like Grand County, Garfield County, Summit County are the hardest hit in our state. Wasatch would be in 4th. This is because of the significant part of their economy that comes from tourism, which has been so devastated by this crisis. You can also see on the bottom left here the economic impact by sector. And you can see in the leisure and hospitality sector, 11.2% the initial claims as a % of jobs. And of course, this data is early, and we've got more data to come because of the lag. So we expect these numbers to get worse. This is more just to show you the distribution. I also want to highlight this column on the right that says Principles for Adaptation. Those that have worked on this, and I should mention the Governor's Office of Management Budget has led the effort. The Department of Health has been right at the side of GOMB in doing that. Salt Lake Chambers played a big role, Economic Development Corporation of Utah, the League of Cities and Towns, the Utah Association of Counties, and many of you on this video chat. But in working with that group, we became persuaded that we needed to tell people that this would not be a switch, but would rather be a dial. And we're thinking of as a brightener. So we're turning up or reactivating the economy. Number 1 makes the point that we don't think this is a short-term problem, but a new risk that Utah is going to have to manage. And it's through vigilance to these instructions that we share that we can manage that risk. And not just a crisis of public health, but a crisis of confidence. And this is a reminder that if we lift public health measures prematurely, we'll destabilize confidence and hurt the economy. So we have to be very data-driven in the work that we do. A reminder to be patient. It's going to take some time. And then a terrific sort of foreshadowing here that version 2 of the plan introduces a suite of tools that can help us on the path to economic reactivation. So in Plan 1, we had the phases. In Plan 2, we're presenting the tools. I won't spend time here talking about the federal response, but you can see this here. I will highlight, though, that in the Paycheck Protection Program, we estimate that that is bringing more than $3.1 billion in cash assistance to the Utah economy. And the direct financial aid that's just hitting bank accounts as we speak. This is the direct payments to individuals adjusted by income. we believe that will bring somewhere around $2.5 to $2.8 billion in assistance to our state, in addition to money that's coming to help with our healthcare system. So I also highlight that local government's been involved. They share their principles. We give some examples of what they're doing. At the urging of the Governor's Office of Management and Budget, Kris Cox, Phil Dean, felt very strongly that we needed to provide information here about some things we could do to support local business and employees. And a lot of this is what's being discussed in the special legislative session. This notion that we could have protocols given to businesses that they get a seal of approval or a certification that they can operate, the color-coded guidance systems, help with personal protective equipment. So we highlight those, and then we provide a 5-step process for utilizing federal resources. This is courtesy of the Economic Development Corporation of Utah, and also information about the small business loans that have been already a topic of these town halls.
You can come on.
Economic reactivation is the key component of 2.0. It's the key contribution. And the governor and legislators just announced a color-coded health guidance system that's going to help us turn the dial on reactivating the Utah economy. So they're introducing 4 levels of risk: a red, orange, yellow, and a new normal of green. I'll walk through those just briefly, but I'll remind you that as we turn up the dial, under every level of risk, the state is asking us to follow these rules of conduct. Number 1, use common sense and personal responsibility. There's no scenario where the state, local government can anticipate every unique situation. People have got to use judgment and personal responsibility as we reactivate the economy. A code of conduct that deals with hygiene and cleaning. A reminder that we must follow the guidance or risk backtracking and causing greater economic harm. And then the absolute realization that the high-risk populations are the area that is of great concern with this virus. So this is the most difficult part for me to explain of the plan, but it's the relationship between the economic phases and the health guidance. So I'm just going to put that right there and kind of pause it for a minute and let you look at that. You'll see the economic phases up top. They are statewide. They have a time frame associated with them. And they follow the natural progression as an economy goes from a shock to recovery. In the stabilization phase, which I expect that we'll enter in the next 30 days, this is where the stimulus monies start to take effect, where our adaptations start to take effect, where innovation starts to take effect, and we begin to stabilize. And this is just a reminder that it won't always feel like it feels right now. And after the stabilization phase, we'll begin the recovery. And you'll note this says through March 2022, we don't know what the future holds. So the state has designed these tools to get us through a 24-month period. Now you see these color codes. Red is high risk, orange moderate risk, yellow low risk, and green is this new normal. And a real important understanding that these codes, these color-coded guides can be applied at the state level, at a regional level, at a county level, or within a community. And of course, these colors are just hypothetically done, but to show you the flexibility that the state has to go in and target social distancing, other public health measures to match the data realities that we see on the ground. That's part of what gets us out of the urgent phase, because the urgent phase has been statewide and very blunt instruments because we are in a crisis. But as we move forward, we can be more targeted in what we do. And the reason we can be more targeted, I'm going to come back to this page, but the reason we can be more targeted is we have better measures and tools in place. And this is where we must give a huge call out to the Governor's Office of Management and Budget that has developed an intelligence portal that includes survey data, local health department information, data collected through a mobile app, some dashboarding tools that were developed by Domo, and also some large-scale testing and tracing efforts that I'll describe next. I'm going to show you a picture of the metaphor of the COVID-19 iceberg. And as you know, right now what we have is an indication of people who are showing symptoms. We know about them because they have symptoms and they show up at our testing stations in the hospital. What we don't know about is what could be as much as 80 to 90% people below the waterline that are affected that we don't know about. And so one of the things the state has put together is a large-scale representative testing program that will allow us to get underneath the waterline and see more detail. And that's the reason that you can complement that with the testutah.com, the mobile apps, the dashboards to learn more. Just to give you some indication of that, I'll show here on the right, large-scale representative testing. It's anticipated the state will randomly test 12,500 people at 25 locations around the state so they can get a statistically valid sample of who has this, who has the antibodies, who doesn't have it, how do we get the ratios to understand how different groups are affected. And it's both the nose swab and the serology test that they'll be doing. And then after that, on a monthly basis, the ability to test throughout the state that allows us to have an idea of where the hot spots or flare-ups will be. I'm now going backwards to show you that under the guidance system, and this is what Derek will often refer to as the best practices that we're looking for, the document does include general employer guidance, restaurant and food service guidance, retail, hotel tourism accommodations, events and entertainment, personal services, home repair, gyms, construction, manufacturing, and daycare as it relates to employment. And you'll note that it says here, industry summary of color-coded health guidance. It's a summary. Jacey could tell us, Derek could tell us, but there's a 20-page some odd list of details that will be made public as part of this. These are recommendations that are made by the Economic Response Task Force. But if I go back just a little earlier, I'll remind you that the decisions for this will be made by the governor with input from a legislatively supported commission that has both health and economic interests. Derek, I can see that Governor Herbert has joined us. I think that's a pretty good summary of what's in the plan. And with that, I'll turn the time back over to you, Derek.
Thank you, Natalie. And I'll turn it right over to the governor. Governor, we kicked off this town hall with Natalie giving an overview of version 2.0 of the plan. I let everybody who's participating know that you held a press conference about 45 minutes ago at releasing 2.0 plan, and that this town hall's purpose was to go over some specifics, but we'd love to hear from you on your view of the importance of this plan and where the state is moving in the next 2 to 3 weeks.
Okay, can you hear me now, Derek? We've had a hard time with our technology here today. Thank you very much for allowing me a few minutes. Let me say thanks to Natalie. She's been just a superwoman in helping us get this thing put together, and her wisdom, her understanding of economics and what needs to be done for government protocol to help us unleash the power of the economy and also protect the health and welfare and safety of our people has just been outstanding. And it really, I think you should go to you, Derek, and all the task force members and everybody who's out there working together. This really is an example of collaboration and cooperation. And the fact we've had so much of it based on a good foundation and policy has allowed us to really be exemplary to the rest of the country. We are by far performing better than virtually any other state in America today. Certainly nobody's better than us when it comes to reducing the spread of the coronavirus and trying to get back to economic recovery. So our message today was that, again, first thanks to everybody, but again, our Utah leads together really is not just a slogan, that's really how we work. We work together. And now we have a 2.0 version, which allows us to go more dynamically from our stages we had in our phases was urgency, which is we're in now at the tail end of it. Then we go to stabilization, and then we go to recovery. And in the new version, we've got these color codes that Natalie's probably talked about, of going from red, which we're in now, going to orange, then to yellow, then to green. And we, in spite of pressures to do more, do less, I mean, we've had it from all sides. We've held the course on following the plan that we've put in place. And the good news is, because we've had a pathway and we've implemented that plan, we've had good results. We are having good results. And our infection rates are down. We hit one of the lowest fatality rates, even one too many, but our fatality rate is the third lowest in the nation, only second to Wyoming and South Dakota, which don't have a lot of people, but we're at 0.78, less than 1% fatality rates. New York, for example, is over 7, 10 times higher. We've got some good results, which allows us now to start moving into this stability. And stability will allow us not to eliminate the protocols of wearing masks, protocols for preventative hygiene, for social distancing, spacing, but it'll allow us to start doing things like we're going to open up the parks now. The state parks are going to be available for people to go out to and participate in. We have some parks that are closed because of the local health department, but we're going to work with them to open them up and ease them up. So a little more regional travel is going to be available. We're going to work with our federal folks to see if we can open up, at least for the people of Utah, our national parks for this summer. We also have the opportunity, as we get into the first part of May, with, again, protocols, social distancing in place, screening of our employees, screening of customers, to maybe open up in-house dining. We're going to have the opportunity to work with our hospitals and the healthcare people to open up surgeries, elective surgeries, as we probably have an infusion of opportunity there, but still saving some headroom in case we have a spike or a return of the COVID-19 virus and have a surge there. So a lot of opportunities for us to improve. Gyms are going to be open up again, hopefully the first part of May also. So you can see that we're going to start loosening the brake. As I've said before, this is not an on-off switch. This really is an incremental opportunity to transition from our urgency stage to our stability stage. And if we do that correctly, then soon around the corner will be recovery. And I think there's a very good possibility, if we'll all do our parts, individual responsibility, common sense stuff, that we can get to recovery here before the summer's over. And that would be great to have us get back to expanding our economy, hiring people, profitabilities out there for our business entrepreneurs. And we can have just a very, I think, healthy fourth quarter of this year. That's the plan. That's the goal. If we all work together, I think we can do it. That's the secret. It really is common sense policies, which we have in place, and individual responsibility to all take upon our own selves to do what we can. And if we all work together, we're going to be able to come out of this soon and very strong. So thank you for letting me come in and just pontificate for a few minutes. And thanks to everybody on the call and the task force for all the good work you're doing. And particularly, Natalie, we thank you for your great work and wisdom.
Thank you, Governor. And I add my echo your comments and congratulations to Natalie. And in addition to Natalie, to another hero in this effort is our own Kris Cox, who heads the Governor's Office of Management and Budget. And Kris is up next to talk about some of the tactics in the operations plan associated with 2.0 of Utah Leads Together. Kris, are you with us?
Before Kris starts, Derek, and before I leave, let me just say I should just praise Kris. Kris has been working, literally around the clock. She's probably more tired than all of us combined. Between her and Natalie, they're just doing yeoman's work. But Kris, I know, is up to the late hours of the night. How do I know that? Because she's always texting me or emailing me or sending me voicemails about what we need to do next morning starting at 7 a.m. So she's been working just tirelessly. She has the data. Again, when I say data-driven, she's the head data driver. And I appreciate the good work of Kris. So again, it's the work of many people, but between Kris and Natalie, we've got probably the brains of the outfit. Thanks, I got to run.
Thank you, Governor. Kris, are you there? Kris, if you can hear me, we can see that you've joined, but we can't hear you. You've got to take yourself off mute, or if someone who's organized the meeting can take you off mute. While we get the technology figured out for Kris Cox, let's go next to Mayor Jenny Wilson, Salt Lake County Mayor. Mayor Wilson is been busy with a county-wide plan that she's going to tell us about. The governor and Natalie mentioned that the Utah Leads Together 2.0 is contemplates a regional approach. And it's important that we take that regional approach, and Mayor Wilson has agreed to take some time to talk about what is happening in her county. Go ahead, Mayor.
Well, thank you. And I would agree with much of what I heard today from the state, from the governor, from others. And I really do want to thank the team, many folks on this call, but certainly Derek and Natalie for the great work that's been done. While the state was doing their work, we were coordinating on the data side, but we also have a more than fairly, a very deep team here who work as our intelligence section, our data folks, and our team that works with our health department to analyze data, to look at international data, national, and especially our local. So we've been coordinating with the state, with Kris Cox's office, and with others, and with the hospitals as we work through the data. And we would absolutely agree that there's been a lot of progress. I have to emphasize there have been some areas where we have very deep concerns, and we have an amazing team working, dozens and dozens of people, some from Salt Lake City, some from Salt Lake County, from other communities, to address our vulnerable populations. We have not had good news in our homeless shelters, and it's very, very difficult. We've seen the challenge in every city in the nation to take a population that is not compliant often, and have challenges around social distancing, both with our street camps, or people who unfortunately remain homeless there, as well as our space inside our new shelters. So we do see some situations where cases are very high, and we are expanding our staff around those to address those issues. I think we also have seen some challenges in our jails, and we know we continue to work to refine. We have continuity of operations plans, and it is very unfortunate. And I can tell you, Sheriff Rivera and our teams are on it and doing our very, very best. Incredibly dedicated. And I would say, other than healthcare workers, these teams are up there in terms of the most rigorous work and the hardest work. So I continue to thank them for that, the diligence and commitment that they're giving to our vulnerable communities. So outside of those situations, and of course we see senior living situations with some challenges, and we at the county are working on those. But if you look at our general population, and you look at my own sense of things, even though I have data often at my fingertips, and I have a healthcare system that I'm close to, and I work closely with our health department. Even I, 10 days ago, would not have been able to say, look, we can say now that restaurant takeout is not spreading cases. We didn't know. We now do. We know that our general population's compliance has driven our data driven it down, and put us in a situation where we can have a better read of next steps. We have a lot of understandable anxiety from small business, from all of us, as it relates to our global economy and our stock market, and I think that concern, and Natalie's so great at helping us through our state specifically. I appreciated a lot of the work that I spent a lot of time on last night, going through from 2.0 to better understand where we can focus. It was very helpful. But we have generally good news. And I think every time we talk, we're going to have to put that asterisk next to any good news, because with our good news, back to the light dimmer going to on again. It's not a light switch. We can't just go out. We have to be careful. We have to protect vulnerable communities, the elderly. Any new rules that I'm going to share with you now, I would not apply to even within my own family, to my parents, who are my mother in her late 70s and my dad now 80. And I don't think that we can take risk with them right now. But what we are going to share today are a little bit of easing of restrictions, and we will parallel the planning that the governor announced around restaurants and around gyms and industry. We're not ready to announce dates yet. It will be May at some point, but we want to be cautious. We want to have another weekend of data. We saw some data go up in our county in the last day or two. We expanded testing quite a bit. So our general sense is that the testing is what led to that. So later today, we're going to make an announcement. It's very much in line with what you heard from the state, but we're feeling that it's time that we, with caution, start to get moving in the community again, and are feeling very, very grateful for the work that's been done. Again, knowing that we do have some particular unique needs in communities, and we're identifying those. Before I turn it back over, I want to say that we are a state that loves our recreation. It's one of the reasons, we've all maybe spent some time away. Many of us have places to go that we enjoy outside of our state. One of the reasons I came back from the East Coast years ago and chose to raise my family here is our recreation. But we have to be smart. I mean, the governor talked about our parks. Well, we are still going to require people don't gather again for some time. Our mass gatherings are way down the road. We can't lift those restrictions yet. We want people to be wise about who and how many friends they're getting together there with. Our order right now does not allow gatherings beyond 10, and that will remain in effect. So I think this idea, the Wilson family, we get together and there's far more than 10 of us that go to my mom's or dad's on a Sunday. We're not going to do that for a while. So it's cautious. Let's be wise. Let's support our vulnerable communities. Let's support the elderly and people in our own families who may be younger but have underlying conditions. The virus's level of its strength has not diminished. It's not going to. What will put us back on the right path is our lessening of social interactions. And I, for one, when we do get back to completely open, are going to take advantage of teleconferences more often because I'm getting more comfortable with it. And I think it's a new way of doing business that will keep our air cleaner and make us all a little more efficient. Of course, I do look forward to the day that I can go back, as you all would like to some level of traditional business, going to breakfast together, board meetings where we need to. But we might find some takeaways from this that I think are useful to how we continue to operate in the future. So today's announcement from the state is appreciated. I'll be doing something shortly, and again, with caution, I think it's good news. So thank you, Derek, and thank you, team.
Thank you, Mayor Wilson. Thanks for joining us on the town hall today. I've been told that we have a technology fix to hear from Kris Cox via speakerphone with Jacey Skinner. So let's give that a try, see if it works. Kris, can you hear me?
All right, I'll speak loudly. I hope people can hear me. I apologize for this. I keep unmuting it. It doesn't let me in. So
that's okay. I can hear you. I can hear you just fine.
Okay, great. It's a real honor to have worked with Derek and Natalie and Jacey and all of the businesses who gave input, and our Department of Health who worked so hard, and healthcare providers to get to this point. I just told Jacey I am not working tomorrow. So it feels like a huge milestone. But I want to give some context, and Natalie did a great job talking about the phases, urgent to stabilization. But think about urgent. When we started this urgent plan, it was maybe 10 to 12 weeks. We've hit the goal of a transmission rate of 1 or less in 5 weeks. And that is remarkable. And I think it's about clarity of vision and purpose and what is it we're trying to achieve. It is so easy for government to be busy and doing a lot of stuff, but not moving the needle. And we owe the taxpayers and the businesses and the citizens and the families and the kids more than that. So this started with, what is it that we're trying to achieve? How do we know if we can start going back to stabilization? What does that even look like? And we needed an objective measure that worked for the healthcare sector as well, because we had to break the conflict. How do you protect public health? How do you deal with the economy? And the first phase of that was to accelerate containing the virus so we could quickly, or more quickly, start reactivating the economy, as Derek says. So we set a goal, which was, we want to get to a transmission rate of 1 or less, and that means basically a pass-along rate. If I have it, I infect 3 people. That's probably where we were, we think, about 5 weeks ago. Today, and yesterday as we ran the numbers, were 1 or less. We hit that goal. And as we move into stabilization, working with stakeholders, we will set new goals that will help create clarity, because without a goal, it's very difficult to know, what do you need? How much of it do you need? When do you need it? How much to scale? Now that we have the data in place, and I'll talk about some of those data points, I'm grateful for Hospital Association and a lot of other people who let us access their data and stand this up in a week. I think government's done things that normally would take months or years, and it shows what can be done when we need to. But we now have the data in place to start understanding what's happening and where. For example, right now we know that ICU capacity in hospitals is 16.5%, meaning they have a lot more capacity in their ICUs. Hence, why they can start having a discussion of bringing elective surgeries back on. But we could see in one part of the state, Weber Morgan County, there was a spike, 53%. We could go talk to them, understand what was going on. It was fine. It was a family that was contained in an employee group. It contained, not a spread. We don't need to worry about it. It'll start to go back down. The data we have now in place is we can look statewide, even by community, as these tools start to stand up and mature, to understand where are the hot spots, where are new emerging transmission networks, who are getting this? Are there certain professions or individuals? How do we protect the at-risk population? And I want to spend a little more time on that. We know that at-risk individuals, age CDC is 65 or older, people who have certain health conditions, are more likely to have severe consequences if they are infected with the virus. So how do we protect them while others go back to work? By the end of next week, we will have an aggressive plan on the at-risk population on its own. We have 5 different categories of those individuals to make sure that we're aggressively doing testing, protection, helping them understand what to do, options for working if they need to go to work. So that'll be a huge part of this plan that will stand up and start evolving by the end of next week. So we're not done. We've just hit a milestone, but there's much more to do. Some of the key data points we'll be looking at: continue new daily admissions. We look at that. It's kind of a proxy for this transmission rate. We look at hospital capacity, both regular and ICU. And then we look at other more operational data points, such as point of contact or point of origin. Where are we seeing these networks, or where are people getting the infection? Our testing capacity, the utilization of our testing capacity. But actually, even more important, how many positives do we have? We use that iceberg analogy that Natalie talked about. There's the people under the waterline. How many of those are we finding per day? And we'll know statewide if we're getting better or not so good at doing that. I'll end with this. We have the advantage of looking across the world and across this country of what worked and what did not work. We don't need to entirely reinvent the wheel. Maybe there's some modifications that are unique to Utah, but we know that significant testing the goal is on demand. Who wants it gets it. Imagine if today everyone could be tested. What we would know about immunity, who's had it, herd immunity, asymptomatic impacts. So testing is going to be huge. And a lot of our tools will help us have more insight of where to move that testing around the state. So I'll leave it at that. But well, let me say one more thing. My office is helping staff this commission that Natalie talked about. And the guidelines that will be published that give the details by industry, again, we relied heavily on the chamber for input on all those. Those will evolve and change as we learn, as we get new feedback, as we see what's working and not working. We'll take those into account and elevate those to the commission so people can make good decisions with that. So this is not over. It's dynamic, and the leaders in this state and who have been involved in this have been fantastic. It's been an honor. So thank you so much.
Thank you, Kris. And that's a great segue into our last two presenters, Jacey Skinner and Dave Davis, specifically to your comment about the industry input that's been received on what businesses can start doing today under the 2.0 plan to start planning for their own reactivation. And this, I mentioned in my introductory comments that we've had about 80 different industry associations, many chambers of commerce from around the state, as well as businesses of varied sizes who are providing input. That's important because we're not talking about a government edict from on high that says this is how you're going to stay safe or stay open. We're talking about a grassroots effort for businesses to show what they can do to adapt, to innovate, and to overcome. So with that, JC, let's go to you to talk about the work that you've been doing with these associations and industry groups.
Great, thank you, Derek. When this whole experience began a little over a month ago, adaptation to the new strict health guidelines was immediate, and it required businesses and owners to think very nimbly and in new ways to adapt quickly to their operations to these very new unexpected circumstances and guidelines that they were just seeing for the first time. But as everyone worked really hard, and I think you saw that, they thought of ways to adapt, to innovate, and we've been able to do that. We've also learned a lot through the process. Very early on in this process, we asked the health department to give us general guidelines for businesses that they could creatively adapt and operationalize to their own unique circumstances. And you saw those operational changes go into practice very quickly. When you walked into a business, you started to see markers on the floor. You started, in lines to keep you 6 feet apart from other individuals. You saw plastic dividers to protect cashiers and tellers. You saw drive-through workers that had credit card machines that instead of taking your credit card, they handed you the card machine itself. And you saw cleaning supplies pop up in every location in every office across the state. There are many more examples of the way that that played out. The guidelines and recommendations for businesses that you see in this plan came in a very cooperative and collaborative way. They started first with the excellent work of those businesses themselves and our industry associations working together with their members. And then through a very collaborative process with the Utah Department of Health and Utah's own Levitt partners under the direction of our former governor and former U.S. Secretary of Health and Human Services, Mike Levitt, we're able to work together to combine and take the best and adapt those practices. They have been able to do that in a way that has given us the most up-to-date health conditions and to adopt the best practices as we know them to the current conditions at the time. As the health department and Levitt partners worked together to develop these guidelines, we then took them back to the industries to gather input, to gather feedback on their practicality as well as their sufficiency. As Derek mentioned, there are many reasons that businesses have been actively engaged in this process, but also that you are going to want to comply with this process. First and foremost is, as Derek mentioned, customers and clients, in order to return or to engage with your business, need to feel safe. And this is one way in which you can do that. Your employees as well need to feel safe and that they are working in an environment where they can trust that their health is cared for. Those considerations all come before the fact that government requires you to do something like this or is recommending that you are doing this. As Kristen mentioned, we expect that these guidelines are going to change. We expect that we're going to learn more, that we're going to get additional feedback, and we want these guidelines to be the most effective possible, which means we will continue to update them as we continue to learn. We will expect that we'll add additional industries for specifics that aren't currently included, and that we will, again, adapt according to best practices as they come forward. If your industry isn't specifically listed and broken out with very succinct guidance, we encourage you to use the general guidance that's there right now that can be adapted to your operations. Or if you have questions about how to do that, as Derek mentioned, we've been working with many industries who have done this, and we can share with you what their practices are and give you a head start as to how that works and what works best. This plan includes a high-level overview, which you will see in the plan that Natalie showed you, and then a longer, much more detailed attachment. We encourage businesses to look at both of these guidelines closely and to prepare. While we have a goal to be able to turn this dial back a little bit, or I guess I should say turn it forward the first part of May, this requires preparation. And we expect that if a business can comply with the most restrictive requirements, they can comply with the least restrictive. So we would encourage you to start with that most restrictive accommodation first. The goal is always to be able to operate in a safe environment, and what constitutes a safe environment will be dependent upon the immediate health risks, and we recognize that those health risks are going to continue to change. So we encourage businesses to be nimble, to pay attention, to work with your customers, to work with your clientele, to work with your employees, but above all, to be a helper. I think throughout this challenge, we have seen individuals who have tried to make things more difficult as opposed to try to make our way through. And just to remember that we are all in this together. Your industry is suffering, as is everyone else's. And everyone working together can create a way forward in a positive way. And so I just encourage everyone to look through these guidelines, to see how you can adapt to them, to recognize that even though we wish we didn't have to comply with them, that is in fact our state right now. And the way we move forward is by in fact adapting and innovating to do that. Thank you, Derek, and I'll turn it back over to you.
Thanks. And now let's go straight to Dave Davis for an even deeper dive into what is happening in his industry to adapt and to innovate and overcome. Thanks, Dave, for joining the town hall.
Thanks for having me, Derek. Can you hear me all right?
Can hear you perfectly. Thanks.
Okay, great. So I wanted to take a minute and just talk about the retail sector in particular. We have a wide array of issues that have arisen as a result of the COVID-19 crisis. We have retailers that have been required to shutter their businesses and are truly just waiting for the economy to re-engage so that they can hopefully come back. And then we have a set of retailers that have been deemed essential retailers, our food, our grocery stores, our convenience stores, that have been figuring out how do we operate in a safe way, both for our team members and for the customers that are coming into the store. So the nice thing about the Utah Leads Together program is it provides some level of certainty in a very, very uncertain environment. We all know that business loves certainty, and this provides the framework for some of that certainty. I would also echo what has been said. There's been input from business along the way, and there's been a careful balancing of those business needs along with the public health needs. This plan is very, very data driven, and but I would add one more component to that I think that is very important is, in addition to having the data out there, having transparency with this data is critical and important. And I think having the operational dashboard so that we can see when it's appropriate to dial things up and dial things back. If I could talk for just a moment about the retail industry and some of the data that's in the more detailed addendum. We were able to provide input on that data. It's a list of best practices. Jacey mentioned a number of items that retailers are currently doing to create a safe environment for their customers and for their team members. As you've been into your local grocery store or convenience store, you've seen that people have installed plexiglass shields. There have been one-way aisles. You see employees wearing personal protective equipment, and all of that is contained in this addendum, laying out for retailers what some of the best practices are to make sure that they're keeping both their team members and their customers safe. It also has the ability to dial up and dial down based upon what's happening on the ground. When we go from red to orange to yellow to green, there are different levels of or different recommendations. And so we appreciate the flexibility that's in this plan as well, and the recognition that maybe one region of the state can be in a yellow or a green situation, and you might have another area that's in an orange situation. And it gives retailers the ability to look and see what sort of area are we in, are we in a yellow situation, a red situation, and gives them some guidance about what some of the best practices are. The other item that was really, really important, I hosted a call with a number of small businesses who were very concerned about how to survive during this very difficult time. And one of the things that they put forward was, how do we know what's available out there by way of programs? What is a PPP and a bridge loan, and how do we access those things? And this plan provides for a place for them to go and to be able to see what some of those resources that are available. The last thing that I would do, I'd be remiss if I didn't do this as I represent the retailers out there, is I would just make a pitch to everyone that's out there listening. As you go out and you shop in your retail stores for essential goods, recognize that you have a group of workers out there that are emerging as our new first responders. It's the bagger and the cashier and the stocker that are out there. We encourage everyone, please wear face coverings as you are out there in those stores. The governor has asked us to do that. Please do that. Shop alone when possible. Bring as few people as you possibly can, and monitor your own health. If you're experiencing symptoms, please don't go into a retail location. Thanks, Derek, for the opportunity to just talk a little bit about retail today.
Thank you, Dave, and please thank all of your members for us. You know, the crisis is hard enough, but there is a lot of hope to be found that we can go to our favorite grocery store, that we can go to our favorite retailer, that we can still go out and find the goods that we need to maintain a good quality of life and livelihood. And echo that thanks that you shared to those frontline workers, because they are indeed those first responders, and we're grateful for everything that they're doing. Just to summarize today's town hall and what you've heard, first of all, the new 2.0 version of the plan with a focus on the stabilization phase, moving to economic reactivation. You've also heard from a local elected official, Mayor Jenny Wilson, talking about how she'll use that plan in her county. An announcement, it sounds like, coming from her later on this afternoon, dealing with economic reactivation. And then finally, getting some guidance for all you business owners out there, other industry association members, to be able to go today to access the 2.0 plan, find that summary of guidance for your industry. We also will be posting that 20-page detailed document that breaks down industry by industry what those best practices look like. It's important that you start, if you haven't already, making your own plan for economic reactivation. It sounds like, from what we heard from the governor as well as what we heard from Mayor Wilson, that we're targeting the end of April, the beginning of May, to have some of those restrictions lifted, to move into that stabilization phase. In some parts of the state, moving out of the color code red, high risk, into that medium risk orange. That's good news for all of us, and it's also because of the efforts of all of us that we're able to do that. So we add our encouragement and caution, as Dave did, to make sure that you continue to be safe in wearing those face coverings, those face masks, so that we don't see that transmission rate that Kris Cox talked about. That sounds like currently is at about a 1-to-1, which allows us that data point allows us to move into the stabilization phase. We don't want to see that creep up and have to dial back the reactivation efforts, and so we can maintain appropriately both the health imperative as well as the economic imperative. We're looking forward to some of those restrictions being lifted as soon as possible, and we look forward and encourage all of you to continue to engage in the economy. As I said at the beginning, and I'll conclude on this note, being open for business is one thing, but we need consumers out there in a safe way, in an appropriate way, engaging in the economy as well. This is one area where we are quite literally all in this together. Thanks for joining the town hall today. We'll look forward to seeing you at our regular time on Tuesday at 4.